Hi, everyone. Welcome to this week's episode of Weekly Dose with Dr. Uday. It's good all about post-traumatic stress disorder today. I have a specialist here with us, Dr. Anderson. She's going to be giving us the lowdown on this topic. So now, before we get started into all of those details, I'll start with introductions. For those that don't know me, my name is Dr. Uday. I'm a board-certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine, and I also own an aesthetic practice. And my goal is to have my patients not only feeling good, but looking good. So let's get right to it. So I have Dr. Theresa Anderson with us today. So let me give you some information about Dr. Anderson. She specializes in the treatment of post-traumatic stress disorder, which is what we're going to be talking about today, but also anxiety and depression. She opened the first psychiatric-based ketamine infusion clinic in the state of Ohio and is one of only 12 providers in the country to offer Prtms, which is a revolutionary form of non-medication alternative treatment. So yes, so Dr. Anderson, thank you so much for being here.
Thanks for having me. I really appreciate it.
Hey. All right, so let's get right into it. So PTSD, or post-traumatic stress disorder, what is it?
So for the longest time, people thought to experience PTSD, one had to go and be a veteran of foreign war, experience some sort of war trauma, watch a buddy being killed, all that sort of thing. But the more we're learning about it, the more we're realizing it doesn't actually require that level of trauma or intensity. So it's about seeing or experiencing something that your brain is perceived as threatening or dangerous or life-altering. So it can be something as big as watching your buddy being blown to pieces in a war-torn country. It could be something as small as, I say small in quotes, as a parent or authority figure putting you down verbally or hurting you physically. And so when the brain is perceiving danger, it goes into a state of fight or flight. And so everything that you're thinking turns into a matter of life and death. And so it puts everything into binary code like computers, right? Black or white, live or die, fight or fly, safe or dangerous. And so your amygdalas are running the show in your brain, and that's the seat of fear and rage. And when your amygdalas are running the show, your frontal lobes can't really take over. Your frontal lobes are your ability to pay attention, your ability to reason through things, rationally think through things. And that's where the gray exists, right? It isn't all about life or death. There are other alternatives in between there, about 50,000 alternatives in between there, but only when your frontal lobes are activated can you actually think through those things. So these folks have either experienced a severe trauma or perceived trauma, not necessarily experienced it or even witnessed it. They might have just witnessed it or been nearby. They have an extreme heightened fight or flight. So they're super anxious. And they're also avoidant of thinking about the trauma, talking about the trauma, doing anything that they could perceive to recreate the trauma. So for instance, if somebody was in a really bad motor vehicle accident, they might be avoidant of riding in cars. If somebody was raped or sexually assaulted, they might avoid dating, so they might avoid those things that could bring about the trauma. A lot of people experience something called flashbacks, and that's where a sight, a sound, a smell, hearing something could bring them back into the moment where they were originally traumatized, and it's almost like a walking nightmare. They could also have nightmares at night, have difficulty sleeping, avoiding sleep. Again, that heightened state of fight or flight makes it hard to calm down and go to bed at night. And especially if you know a bad dream is coming, they want to avoid bedtime like the plague. There's a lot of comorbid depression and anxiety with folks who suffer with PTSD. There's a lot of comorbid substance use to try to turn some of that fight or flight down. So we frequently see all these heightened folks, super anxious folks, turning to substances that turn down the central nervous system, like benzodiazepines, alcohol, opioids. It's very common. Marijuana.
Medicating. Gotcha. So how do you diagnose this?
So getting a good history is the first thing. We talk to the person about what's been going on, how it's been impacting their lives, Have they lost a job or lost a promotion, unable to go to work? Have they experienced difficulty with their relationships? Have they experienced difficulty with their children? Have they experienced difficulty just maintaining what we call ADLs, or activities of daily living? Are you showering daily? Are you eating daily? Are you sleeping daily? And we run through the checklist, the, nightmares, the avoidance, the trauma, or the perceived sense of dangerousness, the level of fight or flight, all the things. And so we take a good history, we figure out how they're being impacted and what we can do to help. And a lot of times it requires medication intervention and or therapy of different types.
Gotcha. So then I guess that leads to the next question of treatments. So what are the treatments that are available for this?
So the standard psychopharmacological treatments usually are in the realms of SSRIs, a type of antidepressants that can be very calming to the central nervous system. Another option is something that we offer called ketamine infusions. And that can sometimes help when medications have not, or people are taking medications and they experience a lot of side effects from it. That is an option. Psychotherapy obviously is an option. Sometimes when people are in such a heightened state of fight or flight, they can't tolerate talking about it. And so that may not be as readily accessible to people in that heightened state. And sometimes they just need comfort and just getting a rapport with the provider and being able to just be. It may not be that they can talk about the trauma initially, but if they can develop a level of trust and respect and know that they're not going to be judged, then it becomes a safe space. Then they can talk about the trauma. So that takes a while sometimes. Another option is something else that we offer called PRTMS, or personalized transcranial magnetic stimulation. And that's a non-invasive EEG guided version of TMS that has about 3 times the efficacy of standard TMS, which is only about 30%. So
awesome. So there are definitely a lot of choices and options.
Absolutely.
This. Okay, so I'm actually going to switch gears. So I'm going to ask a couple questions actually, but this is going to be more about you. So I ask all docs that come on, why do you do what you do? So I'm going to pose that same question to you. Why do you do what you do, Doc?
So it's a fantastic question. So I am a very literary person and I love people's stories. And so I love finding out about the ins and outs of their lives. And to me, it's like, reading the next chapter in your favorite book, right? And so people are like, oh my God, I haven't been here for 6 months. How did you remember that my boyfriend cheated on me? It's like, it's one of my books, right? It's just where it goes. And so I love meeting people where they are. Where they have been, trauma and depression are sort of our bread and butter here. And so a lot of people come to us and they're not functioning very well. And sometimes they just need a hand up in being able to do their ADLs, being able to go back to work, being able to function. And they just need the support until they can talk about the hard stuff. And so to me, watching people change, watching people evolve, watching people essentially tackle their demons, that to me has been awe-inspiring. And you learn so much about yourself and your limitations. And one of my favorite supervisors in residency said, sometimes the best thing that you can do is just be a witness, and so you may not be able to intervene. You may not be able to do anything, but for that person to know that you're there for them is the most healing aspect of, I think, what we all could do as physicians. So
absolutely. Sometimes just listening is enough, or it's a lot. Yes.
Absolutely.
So the other one, this is completely, unrelated, but I love to ask it because I feel like the answer is usually helpful. And it's, if you could, what would you tell your 20-year-old self with all the experiences that you've had so far? What would
I tell my 20-year-old self?
Yes, if you could go back after everything that you've experienced and what you know now.
Stop putting yourself down. Stop doubting yourself. The world will do its best to beat you up enough. Do you have to be another person doing the job for it? I mean, really, because it's you can meet criticism and you can meet a lot of negativity. And I avoid news like the plague because I don't want to hear it's just, yeah. So the world can do plenty of the job for you. There's no reason that you should criticize yourself. There's no reason that you shouldn't believe in yourself, and you can do the hard things. everything that I've worked hard to set my mind to, I've accomplished. And I know that now as my 46-year-old self, but as my 20-year-old self, I was like, I don't know if I could do this. I don't know if I could do this. I don't know if I could do this.
Absolutely.
Just, you can do it, and stop putting yourself down in the meantime, right?
Absolutely. That's why I always ask that question. And most people say similar things, but in different ways. It's just knowing that you're going to be okay and you can figure. And that's amazing. Thank you so much for that tip. So guys, you've heard it. So Dr. Anderson, where can people find you if they wanted to connect with you or they want to look you up, all that?
Absolutely. So if they're going to be in the Cincinnati area, they can feel free to get on our website. It's www.andersonclinic.net. You can always give us a call at 513-321-1753. And you can also find us. We now have our own podcast. Yay. It's called Psych Waves, and we are on Apple Podcasts and Spotify.
I love it. All right, guys, you heard it. So definitely check her out. And if you're looking for a caring family medicine physician, look us up at Apple Valley Family Medicine. Our number is 304-50-1087. We're accepting new patients and we would love to help. And you can also check us out online, www.applevalleyfamilymed.com. All right. Thank you so much. Bye-bye.